Well, hello, everyone, and welcome back. I'm Teresa Blondin, the manager of volunteers and community programs here at Bladder Cancer Canada. And we're so happy to have you here for the final session in the series, Access to Medications. This session is specific to healthcare professionals to empower your patients and their caregivers to advocate for themselves. We want to give one final giant thank you to the team at Eversana who graciously provided us with these webinars and all of the expertise that was put into them. So without further ado, I would like to welcome back Ryan Clarke one more time to present us with sharing your professional experience and empowering patients and caregivers.
Thanks, Teresa, and welcome everybody. So here's our agenda for this evening. Welcome and introductions. I'm going to talk a bit about sharing your professional experience in advocacy, advocating with others, empowering your patients and caregivers, and Q&A. So I'm going to go off camera. I will come back on for the Q&A period. Okay, so just a quick recap. This is our 5th webinar and final webinar. The first one and then many of you I hope joined us for the first 4. We talked a little bit about how government works in Canada and who does what in Canada's healthcare system. And then we built to how drugs are approved and reimbursed in Canada. We then talked about the fundamentals of advocacy. Last week, many of you may have joined my colleague Joanne Koski when she was talking about telling your personal story and using your advocacy tools. And then tonight, we're rounding out the session specifically for healthcare professionals. So for those of you who attended our 3rd webinar, you'll recall that we touched on the importance of the physician voice in advocacy and sharing your what we call professional experience when advocating for your patients. In this webinar, we'll build on that idea and discuss how to determine what elements of your professional experience are most important to include in the story you will share with decision makers to help ensure they hear and respond to your one ask, what you need them to do for your patient or patients around a particular issue. So why is physician advocacy important? Well, physicians have more potential to bring about change than any other organized constituency in healthcare. I say organized constituency. You're uniquely qualified and positioned to be effective advocates, and yet you're not typically formally trained to do so, which again is why we do much of the work that we do. You have a public profile, which is key to getting the attention of politicians. That's very important. And of course, you're closely aligned with the other critical constituency in healthcare, which are patients. And in fact, you're often the conduit by which individual patients choose to get involved simply because you may have asked them to. For further context, you'll also recall from our 3rd webinar that we discussed the 2 pillars of effective advocacy, and the ability to prepare and share your professional experience, in the case of clinicians, with decision makers is the one we'll focus on for the balance of this evening. So how to prepare and share your professional experience. Well, what am I talking about when I say your professional experience? Well, in a face-to-face meeting or in written communication with a decision maker, your professional experience makes your issue come to life. It is essentially your story, except it's delivered in a way that talks about your experience as a clinician, as opposed to technically your personal story. It makes your issue real for the decision maker and provides a point of connection between the two of you. If properly developed and delivered, both developed and delivered, the sharing of your professional experience should fuel the logic of your one ask. And it should be emotional, which doesn't mean negative. People often equate, and we talked a little bit about this, both when I introduced the concept in the third session and Joanne last week in the session with patient stories. Emotional doesn't mean sad or negative. Emotional means emotional, the emotions that one feels. Again, helping to motivate and guide the decision maker to what you need them to do for you. Why sharing your experience matters? Well, as clinicians advocating on behalf of your patients, it's an integral and important part of of your job. And any clinician that I've ever met, physicians in particular, do this without necessarily a great deal of forethought. In other words, you don't arrive at your office in the morning and go, I'm now going to advocate for my patient. You don't typically think of it in that way. You simply learn where to go, who to speak to ensure that your patients receive the care, the treatment, the support that they need. And regardless of who is the focus of your efforts, it could be a hospital administrator, community care program counselor, drug program manager, an elected official, this is advocacy. Anytime, in really simple terms, I tell physicians, anytime you send an email, pick up the phone, send a fax, whatever, it doesn't matter, any form of communication that you make to somebody on behalf of a patient to make a change for that patient, you're doing advocacy. It's advocacy. We talk about formal advocacy versus informal advocacy. This is an important point. When stakeholders or members of the public are invited by government to participate in a structured input process, this is what we call formal advocacy. You are invited to make a submission, for example, to a House of Commons Committee on Health. You're invited to make a submission to CADIF as part of an HTA process. Clinicians are sometimes invited to provide input into a Health Canada review of a medication or a device or a diagnostic. That's formal advocacy. There's not a lot of formal advocacy built into our system, not inherently. So then we have to rely on informal advocacy. And this is when stakeholders or members of the public provide input without being asked formally to do so. So that's when you meet with the Minister of Health, you send a letter to a bureaucrat or whatever it may be. And we talked a lot last week and the week before about advocacy tools, and they're the means by which you engage in this, again, what we call informal advocacy. Professional experience versus personal stories. Again, just to kind of round this out, professional experience is communicated by healthcare professionals to illustrate the impact of a healthcare issue or a policy on both you and your patients and potentially caregivers. So in other words, this is how your policy, government, impacts my ability to provide care as a healthcare professional to my patients, in really simple terms. Conversely, a personal story is communicated by an individual who is going through the healthcare system or is impacted by the policy, and it's having a direct impact on them as a recipient of healthcare, if you will, or what I'll call an end user of healthcare. So government, your policy, your processes is having a direct impact on the health and well-being of my family. And let me tell you why. That's a personal experience. You can see how they're sort of, they fit together. It's just it's a similar perspective given from a different viewpoint, if you will. As I mentioned, your ability to share your professional experience is the key to your success, particularly when advocating in person or virtually, as is the case currently. So you've really got two choices when you decide to share your personal experience, your professional experience, excuse me. You can either tell a summary of your entire experience as it pertains to the issue at hand. Remember, when you're sharing your professional experience, it always has to connect to the issue that you're there to talk about. So again, in simple terms, if you're there to talk about access to medications, your professional experience and its story cannot be focused on delays in access to treatment or something like, or delays in diagnosis, for example, which it's got to have a connection to the issue at hand. Or you can tell a portion of your professional experience that focuses on one or two aspects of the issue. So a summary of everything, or a portion. But again, it's in either case, it's connected to the issue at hand. I don't know how many of you have ever written out your professional experience for any purpose, but you really need to do so if you're going to be an effective advocate. It is essential. It is essential because we all forget things. It's an ongoing story that you'll always be adding to, and you're going to need to create versions of your experience, as I noted above, with this idea of either a summary or a portion. It's also essential because you're allowed to read it if you choose to. I always tell people, remember, when you're sharing your professional experience or your personal story, it doesn't matter. It's not a test. It's not being done in the public domain. It's, for all intents and purposes, behind closed doors. You don't have to be perfect at communicating your professional experience for it to be very effective. In fact, sometimes reading it can be the most impactful way to do this, made even easier in the context of virtual meetings. And we show people, we demonstrate to people how reading a personal story or professional experience can be even more impactful than necessarily memorizing it or just doing it off the top of your head. And quite frankly, doing it off the top of your head is never advised for some of the reasons I just shared. There are 4 elements that should be included in the sharing of your professional experience for the purposes of advocacy. The first 2 are pretty straightforward. Some basic details and facts about you and your practice or your background, if you will. Your key messages will be included in the issue section of your professional experience. They help to explain the problem and the change you need to be made. You will remember this if you were with us for the 3rd webinar. At every point, convey your feelings about the details or events you're describing, as well as suggestions or solutions to achieve your one ask. So let's just review the 4 in a little bit more detail on the next few slides. The objective of this first section is to establish a basic picture of who you are in the eyes of the decision maker. So your name, you don't have to share your age, but you know what I mean. So just age, where you live, like just again, think of it as establishing kind of just a baseline or a jumping off point. Your specialty, how long you've been practicing, sort of thing. Further details about your practice, including the therapeutic area connected to the issue at hand. And remember, always remember, to use the words I, my, me to best share your experience. You're talking about yourself, and you can't talk about yourself without using those words. And so that's very important. I mention this because I've heard people tell personal stories where they don't use those words or claim to share a personal story or personal experience without using those words, and you can't. It's impossible to do. This is the point where you transition from having set the stage to the circumstances that have brought you to today. There is an issue that is impacting your patients and your ability to treat them. This is also the first opportunity in most stories to start to open up about your feelings, really, for lack of a better word, which, as I said, is critical if you're going to connect with the decision maker. So if there's something going on and you as a clinician find it frustrating, say, I'm frustrated. I'm frustrated at this policy, this issue, which is impeding my ability to care for my patients, or whatever it is that you're trying to convey. Don't shy away from that. Next, you need to transition to the issue at hand. In other words, if you practiced in a healthcare system in which everything always unfolded perfectly for both you and your patients, you presumably wouldn't need to do advocacy because nothing would need to change. So this is where you need to talk about the challenges you and your patients have or have had as it relates to the issue at hand. Again, I've said this several times, you have to keep coming back to and focusing on the issue at hand. So again, if the issue is access to medications, you don't focus on prolonged time to diagnosis. You can mention all of the challenges you may have faced. I don't mean you are only restricted at talking about the one issue, but you need to focus on this, the part of the story or the challenges that you're having that are linked to the issue that you're there to try to resolve. Otherwise, it'll be very confusing to the decision maker that you're advocating to. Quite frankly, they won't know what it is you're there to talk about if you talk about everything, and they won't know what you're asking if you're asking for everything, or you're asking for nothing, or you're not making the clear connection sort of thing. So it's almost like painting a picture sort of thing. Which leads us lastly to your one ask. What do you need the decision maker to do as a result of what you've just shared with them? And again, we went through this in quite a bit of detail in the third webinar. Now, having sketched out those 4 elements, having painted this picture, next think about your patient's clinical journey as it relates to the issue at hand. It's also possible that this issue could be impacting more than one of your patients. So the experience you share could be an aggregate of your patient's journeys. There are a few things you can do to ensure that the clinical elements needed to reflect a patient journey are included in the experience you share in your story, such as pulling patients' charts or interviewing the patient or patients to fill in any gaps or to ensure you are capturing their perspective in your story. So just as journalists ask questions that are appropriate to their task to report what happened, who made it happen, how it happened, etc., you too can formulate questions that can help you get to your story or get to your experience. Of course, you'll also need to answer the questions you posed. So think of it as interviewing yourself for an article almost. So looking at the slide we have here, when, where, and how, when, where, and by whom was your patient's diagnosis made? What challenges has your patient faced as a result of the disease, or have you faced caring for the patient? When and where have they occurred? How have you overcome or managed these challenges? What does the government need to do to resolve this issue? How have you or your patient helped yourself? How have others been helped? This is a really this is an important point I just want to spend a moment on, because the most effective advocacy is really about demonstrating to a decision maker, this is the challenge we have. This is what we've done to try to resolve the challenge, but here's what remains outstanding. And here's what you need to do to help us in what remains outstanding in order to resolve the entire issue. It's the whole idea that governments prefer to help people who help themselves, kind of thing, or who contribute to the solution around the problem, as opposed to just coming in and saying, I have a problem, I don't know what to do, and you throw up your hands. That is not very appealing from an advocacy perspective. And then why is inaction not an option? Sort of showing that is important. So these questions, if you answer these questions, can really serve as a foundation for what will ultimately become your personal experience. We can't emphasize this enough. The sharing of your professional experience needs to be focused. I know I've said it 10 times, but I'm saying it 10 times because, as I said, it's critical. All of the details and descriptions needed to illustrate your issue and lead to your one ask is really what we're talking about. Everything needs to lead to your one ask. Making sure your professional experience is always on topic and relevant can be a challenge, though, even when you've only got a short period of time to tell it. So we came up with something we call the 5-minute story challenge. And you may remember this, we use it also with patient stories, but it's applicable here too. If you can't convey your experience effectively in 5 minutes, ask yourself these questions on the slide and make the changes needed to tighten it up. It's about tightening it up, making it, again, more focused than it is. You should know that typically almost no one gets their professional experience down to the essential elements delivered in 5 minutes on the first or even the second try. But if you keep trying, you will get there. This is the whole idea that less is more. This is about figuring out, how can I say as much as possible with the greatest impact in the shortest amount of time and with the fewest words necessary. Now, at this point, you're nearly ready. Your story is no more than 5 minutes long, and it makes a compelling case for your one to ask. You're satisfied with what you've written, and you're preparing for a meeting with the decision maker. Now, let's review a few tips to help you start advocating with confidence. And we've touched on some of these things already, but let's just go through it to be sure. As you read or practice your personal story, and we suggest your professional experience, we suggest you read it out loud. Watch for spots in your story where you tend to ad lib, that is, where you improvise and add material that isn't written in your experience. Resist this urge to improvise and add to your written story. So reading it aloud, practicing it, inviting somebody to listen to it, and then provide you with feedback to make sure that you're not going too fast, you're not going too slow, but you're really kind of going through it at a good pace, at a pace that is easy to listen to from the target's perspective, the person you're advocating to's perspective. Time yourself. Again, we talk about 5 minutes at the most. It's often less time. Sometimes when we're nervous, we tend to rush through. So make sure that you don't do that, but also make sure that you don't go way over time. The first draft of most personal stories for patients and professional experiences with healthcare professionals tends to be long, too long. And so this is where we need to tighten it up, kind of thing. So again, adjust accordingly, because 5 minutes is the ceiling. It's usually 2 to 3 minutes that you'll get in most circumstances to be able to share. For people learning to present their personal stories for the first time, as I said, not only recommend not memorizing it, we suggest you consider reading it for some of the reasons that I've provided already, but also for some of the reasons that that again I'm showing you on the slide here, kind of thing. It's again, it's a way for a lot of people to even get through it. A personal story or a professional experience has a flow to it. It has a beginning, a middle, and an end. And again, unless you are very good at communicating in this manner to these kinds of decision makers, reading it is the only way to know for sure where you are in that beginning, middle, end that you need to get through. Again, stay focused. Sounds easy to do, but it can be challenging if you're advocating to someone who, for example, likes to interrupt or who is not a good listener. So if you are interrupted or if they ask you a question, you don't want to be rude, but it is okay to respond by saying something like, "That's a good question. I'll just finish reading what I've written here and then I'll answer it." Now, if you want to answer it, go ahead and do that. I'm not saying you can't answer it, but you need to remember to answer it and then get back to where you were. And you need to know where to get back to, and you need to stay focused, and you can't get off track. So if it's a very simple question that you can ask, or excuse me, that you can answer very succinctly, answer it and then go back. But if it's a complex question, or if it's leading down a road that you're thinking, okay, I want to sort of think about or formulate what I want to say before I say it, I would suggest you say, "We'll come back to that. Let me just finish here." And of course, you can practice this. We practice all of this with people, but you can practice this. Have somebody who you're reading this to pretend to interrupt you or pretend to ask you a question, and then see how you sort of handle it. And then anticipating questions. One way to do that, of course, is to review some relevant background information, or even think to yourself, well, if I were an elected representative, what would I want to know if I were listening to this professional experience? And how is what I'm saying linked to what is important to them, their agenda, their policies, their priorities, that kind of thing. We tell people you may want to prepare for tough questions and be prepared to speak to them, and also be prepared to not answer a question if you don't know the answer, kind of thing. So if it's a question that you don't know the answer to and requires more information, you can say, "I'm not sure the answer to that, but I can get you that information." Now, that's different than a question that you prefer not to respond to for whatever reason. We're bridging over now sometimes into a little bit of media. But if you prefer not to answer a question, or you think the question is inappropriate, you can simply just bridge back to your key messages or your one ask, which is essentially not answering the question. I can't really think of many circumstances where it's happened, but it is a technique just to be aware of. So let's shift gears here just as we reach the conclusion of the presentation and talk about advocating with others. So one thing we spend a lot of time counseling healthcare professionals and others is this idea of advocating as a group of physicians. You can do so either through a formal association or organization, or just an informal group of colleagues, which could also be across professions. It's often required when you are engaged in formal advocacy. So governments typically only want to hear from established groups of stakeholders. I don't necessarily mean a legal entity, but they're often, that's their preference. Requires consensus on the issue at hand. If you're going to advocate as more than one person, you have to come to an agreement about what it is that you want to say and how you want to say it. There's key messages, your one ask, all that kind of thing. But it can be very powerful when positioned as a unified voice, whatever it may be, a letter or that kind of thing, or a face-to-face meeting. Contrast that with working with patient advocacy groups. Clinicians, physicians in particular, often work with patient advocacy groups either as a member of their scientific or medical advisory committees. Again, it demonstrates a unified voice around a particular issue, or certainly can. And it's an ideal opportunity when advocating to a decision maker, somebody in government, to blend, again, what we call clinical context or experience with the patient caregiver journey. Think of it as two sides to the same coin. The clinical components, clinical experience, professional experience on the one side, and on the other side, the patient caregiver story or journey. And that creates an extremely powerful narrative for the decision maker. Because remember, depending on who you're advocating to, they may or may not have any understanding of the clinical content that you do as physicians, for example. If you're advocating to politicians, unless you know otherwise, they're not going to have any of that background. Bureaucrats may, depending on the circumstances. Other targets may have clinical experience, clinical knowledge that you have, which is fine. You can then speak to them as peers. But if you're speaking to a politician, they're not going to know what you're talking about if you speak to them in what I'll call clinical language. So that's why we talk about sharing your professional experience in a way that even a lay person can understand and can be connected to. That's the key. And then engaging your patients and caregivers. You can either advocate with them or you can empower them to do it on their own if you choose to do so. When advocating together, make sure that you clearly delineate who's going to say what and in what order. So there's if you're in a meeting, for example, there's the physician role and there's the patient or caregiver role in that meeting, kind of thing. Make sure that each of you share your professional experience or your personal story. That goes without saying. And typically very impactful when you choose to do this combination because of the relationship that you have with one another. I would say that in my experience, the most powerful, what I'll call entire or collective stories are when the treating clinician sits down with the patient or caregiver who is their patient and the caregiver to the patient, and you each tell the same story from your perspective. As a patient, this is what I've gone through. As a caregiver, this has been my journey. And as a healthcare professional, as this patient's healthcare professional, this has been my experience in caring for this patient. That is unbelievably powerful the most powerful you can imagine from a story perspective when you're advocating to decision makers. And for our final slide, if you've ever considered playing more of an empowerment role, here are some initial questions we've come up with for your consideration in helping to identify someone who could become either an advocate on their own behalf as a patient or caregiver, or on behalf of someone else, for example. So I put this list together because through our work and through our experience, we were approached by clinicians who wanted to know, how do we help our patients when they come to us and they say, you know, how can we help them identify what to do and how to do it and that kind of thing. We responded with, well, you need to be able to identify who is the best person to be able to potentially do this work. So we came up with, and this is not the entire list of questions, but these are some of the questions. Does the person have any experience doing this kind of thing? Does the person have a willingness and a general ability to engage in advocacy in terms of basic communication? Are they in a position to devote any time to advocacy? Do they have an understanding of health policy or the decision-making processes? And do they appear to have the temperament for advocacy? This goes for everybody who does this sort of work, i.e. focus and patience and that kind of thing. Now, you don't have to answer yes to all of these questions to necessarily be either a good advocate yourself or to be able to identify amongst your patients a good advocate. These are guideline or guidance questions, and a strong answer to any of these questions, a strong yes to any of these questions is likely to lead you down the road where either yourself or the person you're considering engaging most likely will be able to do this. So if you find people who meet these criteria, you should also consider demonstrating or reassuring them that you believe in their ability to do this work, because as clinicians, I've witnessed that you are in a unique position with a particular ability to motivate them. So we often counsel the clinicians that we work with, who choose to play this empowerment role, of course, to tell their patients or caregivers that you believe in them, remind them that you appreciate their role as advocates, and be willing to listen to them on an ongoing basis when they come to you with challenges or updates on where they are at. Now, I know this is a lot to ask of a physician. That's not my point in sharing this with you. I'm sharing this with you because we were asked by physicians, or have been asked by physicians over the years, how can I help to make my patients better advocates? And the really, really simple answer is just keep nudging them along. Keep telling them that you believe in them. Listen to them. Again, I'm contrasting that with you having time to be able to do this, but leaving that aside for a moment, which I know is a challenge, but leaving that aside, just listening to them can often be what they need to be able to do this work. In other words, we don't counsel people to help them solve their challenges. That's why we're here. We help people figure out how to do this when they reach barriers or stalemates or whatever it may be. But just your being in their corner, on their side, being a cheerleader almost for them, is what we have found often helps empower patients and caregivers, and sometimes even yourself as physicians, to be able to continue to move forward. And that's it.
Well, thank you so much, Ryan. Clearly defining why sharing your professional experience really matters to make patients better advocates. So we'll open it up for any questions. You can use the chat function or the raise hand button so I can unmute you. But I do know that Ryan has a couple of frequently asked questions that he can jump into too in the meantime.
Yeah, sure. So Thanks, Teresa. So yeah, just a couple that we sort of thought of off the top of my head that do often come up. Um, one of them, one of the obvious ones, I trust it's obvious, but I'll ask it anyway, is the whole idea of consent. So, do I need a patient's consent, for example, before I share the details of their story or their experience? In other words, you're a clinician, you want to share your professional experience, but in order to do that, you have to illustrate it by talking about your patients. Well, obviously, the short answer is if you're going to talk about somebody in particular with some kind of an identifier, then you would need their consent. However, in most cases, you don't need to do that. You don't need to identify who this person is, obviously. You could just say, this particular patient I have, give a brief sort of, she's 38 years old, here's her circumstances, and then you can share her story. For that, you wouldn't necessarily need her explicit consent kind of thing, again, because there's no identifiers. You could get it if you want, but you don't need it. The other thing that's important to point out as well is that sometimes it may not be appropriate, or it may not be, or you may not be able to identify a particular patient that you want to use to illustrate your professional experience. And so we tell clinicians you can use an amalgamation, if you will, or a blending of several patients in order to illustrate your point. The other question that we often get asked in particular, are there limits to what I can do, you personally can do as an advocate, sort of thing? So for example, if you've been asked to provide input into a drug that's under review at CADITH or Health Canada or that kind of thing, can you then turn around and advocate either formally or informally for access or approval to that same medication? The short answer is maybe, or it depends. There is no legal prohibition against you doing it. However, there are ethical concerns, there are professional concerns that you may have with that. And so on a case-by-case basis, or whatever I would suggest you feel comfortable with, or from potentially even a regulatory perspective, a contractual perspective, there may be limitations. But I just want to be clear, I trust we all know this, but there is no law out there that says you can't do this or you must do this or that under this circumstance. There may be other constraints on your ability to do it, but generally speaking, conflict of interest is something that starts with you as an individual. Do you feel it's a conflict of interest? And the whole idea of perception. If it's perceived to be a conflict of interest, we always recommend that you err on the side of caution, of course. And if it's perceived to be a conflict of interest, then it probably is, or you believe it is, and therefore you should not be in that situation. So you may want to excuse yourself or choose not to participate in something, but it really depends. I have seen and I have worked with clinicians in various circumstances who have engaged in all kinds of different advocacy, depending on their essentially comfort level.
Okay, hi, Michelle, you're on.
Hi there. Hi, Ryan. Thanks again. I don't know if I've got my camera on here. Just wanted to thank you, Ryan. There's just some great information here, and it's more of a comment, I think, to say your last point about working with patient advocacy groups. Of course, Bladder Cancer Canada is one of these, and just the power that you relate about combining that clinical and patient story. And so to say to the clinicians on this call or this webinar, Bladder Cancer Canada has a significant resource base for those types of patients that truly do want to advocate and share their story. I'm thinking of the examples of the BCG shortage, that we went through, and we do this all the time for media, but definitely open to clinicians who want to advance some of that advocacy. Even on a local level, we have patients that are well versed in the issues and happy to share their story, so they're primed already.
Thanks, Michelle. No, I appreciate that, and again, I always try to be very clear when I'm speaking to physicians in particular about advocacy, that my job is not to sit here and say you should do this, you should do that, you have to do this, you have to do that. It's simply to say that based on my experience, based on what I know, based on what I've seen, the addition of a clinician, particularly a physician voice, to the patient voice and to the patient group voice is exponential. It doesn't just add a bit, it adds a factor, a multiple to what can be done. All of the elements are critical. They're all part of an ideal situation. Again, those parts being physician, patient group, and individual patient and caregiver. They're all critical. But boy, if you want to see a patient group and a patient really accelerate their ability, particularly when advocating to governments, and I'm removing politicians here, bureaucrats, decision makers, those kinds of people who rely on clinical evidence to make typically recommendations, sometimes decisions, having you at the table, there's just no substitute. There just absolutely is no substitute. There's nothing else I can put there. There's nothing else that can go in there. It's kind of the physician voice or nothing, quite frankly. So thank you, Michelle.
Thank you.
All right, well, thank you again, everyone, for attending, and a huge thank you to Ryan and the Eversana team. The series really was so informative and empowering to people to be more effective advocates. Any feedback can be sent to info@bladdercancercanada.org. Thank you, everyone. Have a great night.